The Emergency Medical Treatment and Active Labor Act requires hospital emergency rooms to provide medical care and stabilization for all patients. The White House wants that measure to include abortion access, even in states where the procedure is banned. As the High Court hears arguments over the issue, pro-life doctors are holding out hope for another victory.
We're talking about elective abortions being forced on doctors to perform them by a federal fiat.
Roger Severino of the Heritage Foundation says deliberate misinformation surrounds the law, also known as EMTALA.
There are some circumstances where you do have conditions where the life of the mother is at risk, and doctors are still able in every pro-life state to save the life of the mother, even if it incidentally results in the loss, tragically, of an unborn child. That's not what we're talking about here.
Under the law, hospitals that receive Medicare funds must provide emergency medical care. The Justice Department argues abortions can fall under emergency medical care, so healthcare providers should perform them. Earlier this year, a federal appeals court ruled Texas doctors aren't obligated to perform abortions under the law. The ruling followed numerous lawsuits from women who live in Texas, Tennessee, and Idaho, saying due to their state's bans, they were denied abortions despite having dangerous pregnancy complications.
The state doesn't care about the lives of their constituents.
Last summer in a Texas courtroom, women testified the state's abortion ban put their lives at risk.
I had just been given the worst news of my life. And I was terrified.
18 weeks into her pregnancy, Amanda Zarowski's water broke. After developing sepsis, she says she nearly died. While a number of states with abortion bans allow for exceptions if the mother's life is in danger, many experts say it's not clear when those exceptions can be applied. Dr. Susan Bain, board member of the American Association of Pro-Life Obstetricians and Gynecologists, told CBN News clarification is vital.
I do think that physicians, other healthcare practitioners, it is the responsibility of hospital systems, the legal system, to make sure that doctors and healthcare practitioners really understand the law, because we're not attorneys.
Severino argues that abortion activists are using the issue to spread fear among pregnant women with health challenges.
It's politically convenient for the left that is very pro-abortion to try to scare people. There are so many instances of pro-life doctors who are out there saying, look, we do this all the time, we're OBGYNs, we know the tough cases.
The most common ones we see, I already talked about preterm rupture of membranes, but also hemorrhage, and then high blood pressure that's severe enough, something called preeclampsia or eclampsia. When we intervene for medical emergencies, we can do it without an abortion. We can separate the mom and the baby, but our intention is to hopefully have two living individuals when we're done.
Bain adds today's politically charged environment also makes decisions challenging for any doctor.
We've really seen a movement in our profession of OBGYN to where instead of doing our jobs of taking care of both, the answer to any risk factor is, well, go ahead and have an induced abortion and just eliminate the risk factor. And I'm like, time out.
Severino points out training is now required for many med students.
This is a sad thing. Now we see this in medical schools where the accrediting bodies are saying you have to train in abortion to get a medical license. So students are being forced to assist in these abortions. They're trying to move it instead of a opt-in as an opt-out to pressure medical students to do abortions when the overwhelming majority of the profession, they went into medicine to save lives, not to end lives.
Meanwhile, Severino says if doctors are forced to violate their consciences by performing abortions, many of them will quit practicing medicine altogether. Charlene, CBN News.